welcome back. Today we're going to be playing laser eye surgery on surgerysquad.com. So let's get started. So how was everyone's day today?
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery.
Yay!
We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Okay. I did it. Wait, let me do this. Oops.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum over the eye.
Girl, open your eyes open. Alright, keep pressing
If the patient was allowed to blink, we might cut or burn the wrong area.
Oh God, no.
At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye.
Okay.
The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring.
Y'all gonna cut up her
We slide it
eye?
across and it cuts the
whole
top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
I did it. There, I did it. That looked like it
With
didn't
the
hurt.
corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Do this hurt to her? Okay. Are we pulling back?
This is the part we'll reshape with a
Oh,
laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound, and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position, making sure our ink guides match up.
I can't do it. Why let me? There, I did it. I did it. What else?
Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery.
Yay!
You can see more of my superior surgical technique and my other procedures here on SurgerySquad.com.
Let's do the virtual dental filling. But my granny actually got laser eye surgery. I mean, I wasn't in there with her, but she got one, so. Hey! Hurry up!
Welcome to Surgery Squad's virtual dental filling placement. I'm Dr. Jeff, and I'll be guiding you through this procedure today. Fillings are the most common and affordable dental restorative procedure for both children and adults. They're used to restore the function and integrity of missing tooth structure, commonly caused by tooth decay. By placing a filling, we reduce the amount of bacteria in a patient's mouth, extend the life of the tooth, and delay the need for additional dental work indefinitely. Our patient today has been experiencing some slight discomfort in their lower left first molar, or
You've been
as
on
dental
here for a
professionals might say,
pregnant,
tooth 19.
a C-section,
Before we
a
begin,
vaginal
we need to get
birth,
some x-rays taken of our
a
patient's
breast
teeth.
thingy
X-rays or radiographs
She
are
been on here a
essential,
lot more
low-cost
times. I
diagnostic
know she been
tools
on here for a
used to examine a
C-section,
tooth's roots, check the
a
health of the
a
bones
vaginal
surrounding the
birth,
tooth, observe the
a
status of
silicone
developing teeth,
breast
and
implant.
find abnormalities
She been
such
on
as
here many
cavities.
times.
Let's get started. First, insert a positioner into the patient's mouth.
You been on here many times, girl. Oh, I hate when they put that in my teeth. Just feel
Next,
running.
position
funny.
the x-ray cylinder where indicated.
We taking pictures of your teeth.
Great. With the x-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to. And take the picture. Don't worry, the lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant handle the other x-rays, so let's move on. With all of the x-rays completed, it's time to look for potential issues. When examining dental x-rays for cavities, look for hints of changes in the density of a tooth's enamel, or dentin. These locations will appear as darkened areas on an x-ray. This is because the decayed portion of the tooth is less intact, and the x-rays can penetrate that portion of the tooth. Do you think our patient has a cavity?
Yes. Yes, I do. Yes, I do. Do you think she does? Yes.
I agree.
Yes.
Can you identify it on the x-ray?
Fuck. Okay. It looks like this because this one is missing.
There it is.
Yes!
We need to get that taken care of as soon as
Got
possible.
both of them right.
Let's get started. Now that you've identified the cavity, we need to apply a topical numbing gel to the anesthetic injection site to help reduce any discomfort the needle may cause.
They actually did this to me when I was little. But I didn't cry. But my brother did. That's disgusting.
Next, we can administer the local anesthetic. The patient will, at most, feel a slight pinch. Afterward, the area will become numb for hours, even though the procedure will only last a few minutes. Take the syringe and inject the local anesthetic into the patient's gums.
I'm sorry.
And now we'll give our patient a few minutes to become completely numb. Now that our patient's mouth is numb, we can move on to removing the decay. To begin, we'll need to isolate the tooth using a cotton roll. This will give us some space to work.
Oh, well, they stop making
Looks
that
good to me.
noise.
Dentists typically remove tooth decay with a burr inserted into a handpiece. This is what most people refer to as the drill. Prepare the area by using the burr to carefully remove all of the decay from our patient's tooth. Now that the decay has been removed, we need to figure out which type of filling our patient wants, amalgam or composite. Both have their advantages and disadvantages. Amalgam fillings are more durable than composite, but they don't have a tooth-colored appearance like composite fillings. They also often require a larger portion of the tooth to be prepared in order to retain the filling. Composite fillings are much more aesthetically pleasing and require less drilling than amalgam, but they can be a bit more expensive.
I mean, this one right here is ugly. So why would she want the ugly one? I think she want the composite. I mean, it costs my money, but you get what you worth. So,
Sounds good to me.
yeah.
For a composite filling, we need to apply a self-etching dental adhesive to the prepared area of the tooth. This creates a rough surface that helps the filling bond to the tooth. Now, dry the area using the air syringe.
The air syringe.
Next, you'll need to apply the self-etching dental adhesive to the prepared area of the tooth one more time. Use the curing light to harden the self-etching adhesive.
Oh, they put that in my mouth all the time.
Nice job. Let's get a filling in there. Take the composite filling syringe and place it into the prepared portion of the tooth.
They put that in my mouth too. They put that thingy, that blue thing
Pack
that's
the
a
composite into the
and that little
prepared area
syringe
of the
thingy
tooth
too.
using a condenser.
They use that too in my mouth.
Next, you'll need to smooth the filling using an instrument called a burnisher. Great. Place the curing light over the tooth and activate it to polish the filling using the polishing instrument.
See, don't it look much
At
better?
this point, the dentist checks the patient's bite to ensure that everything was normal and the patient doesn't experience any discomfort. Fortunately for our patient, you did an amazing job, and there doesn't appear to be any issues with the filling or our patient's bite. All done. It looks perfect. After the procedure, our patient may experience some sensitivity, but it should subside within 1 to 2 weeks. If it doesn't, they'll need to contact their local dentist office. There is also the possibility that the patient's bite may feel a little off, since being numb can
I don't care. And bye, you guys. See you guys tomorrow. And bye.